السلام عليكم. محاضرة اليوم حول Digestive System Disease، أمراض الجهاز الهضمي. Assessment of the gastrointestinal system. Health history. A focused GI assessment begin with a complete history. Information about abdominal pain, dyspepsia, gas, nausea and vomiting, diarrhea, constipation and previous GI disease is obtained. Common symptom. راح نتطرق للcommon symptom اللي تتعلق بالdigestive system. Pain can be a major symptom of GI disease. The character, duration, pattern, frequency, location, distribution of referred pain and time of the pain vary greatly depending on the underlying cause. Pain assessment يكون تقييم الألم على أساس مقياس ال PQRST. ال P هو ال palliative factor, what making it better or worse. Also Q هي ال quality, نوعية الألم، أما تكون sting, dull, sharp or burning، يعني يكون على أساس حرقة. R هي radiation or location، أي انتشار الألم. S severity، أي يكون على أساس مقياس scale من 1 to 10 or similar. T هو timing، الوقت مالته. When does it start? For example, when was the last pain medication? Dyspepsia, upper abdominal discomfort associated with eating, especially with eating, commonly called indigestion, is the most common symptom of patient with GI dysfunction. Indigestion is an imperious term that refers to a host of upper abdominal or epigastric symptoms such as pain, discomfort, fullness, bloating, belching, heartburn or regurgitation. Typically, fatty food cause the most discomfort. حقيقة الطعام اللي يحتوي على دهون يكون أكثر discomfort for abdomen because they remain in the stomach for digestion longer than protein or carbohydrates. Intestinal gases. The accumulation of gas in the GI tract might result in belching. Belching هو expulsion of gas from the stomach through the mouth. Or flatulence هو expulsion، هو إبعاد أو استبعاد of gas from the rectum. Usually gases in the small intestine pass into the colon and are released as flatus. Patients often complain of bloating, distension or feeling full of gas with excessive flatulence as a symptom of food intolerance. وحقيقة هو مؤشر للفود intolerance هو excessive flatulence، excessive أو increase بالflatulence. Nausea and vomiting. Nausea is uncomfortable sensation of sickness or queasiness that might or might not be followed by vomiting. حقيقة قد يحدث الفوميتنج، إما يكون قبل نوزيا غثيان أو قد لا يحدث. It can be triggered by odors، يحفز بواسطة odors, activities, medication or food intake. The emesis or vomitus might vary in color and might contain indigested food particles, blood أو قد يحتوي على blood. يطلق عليه مصطلح الهيماتايميسيس or pilous material mixed with gastric juices. Change in bowel habits and stool characteristic. Change in bowel habits might signal colonic dysfunction or disease. راح يصير عندنا change بالhabit التابع للباول، أي راح بالعادات الغائط راح قد يكون إما increase أو decrease. increase بالفريكونسي of bowel or stool راح يطلق عليه مصطلح diarrhea and abnormal increase in the frequency and liquidity of the stool commonly occur when the content move so rapidly through the intestine and colon that there is inadequate time for the digestive system or digestive tract secretion and oral content to be absorbed. أي إنه راح يصير سرعة بحركة الكونتين of food خلال digestive system، وبالتالي راح يخرج بالخروج، فما راح يصير عملية امتصاصه بالآلية الصحيحة أو بالآلية يصير بها absorb امتصاص كامل للطعام، وبالتالي هذا المصطلح يطلق عليه diarrhea. أما constipation تقريبا هو عكس الديارية، هو decrease in the frequency of stool or stools that are hard, dry and of smaller volume than normal may be associated with anal discomfort and rectal bleeding. وحقيقة constipation اللي هو increase بالفريكونسي of stool دائما يكون stool hard and dry ويكون بكميات قليلة، وبالتالي يكون associated مرافق أو مصاحب دائما most common symptom هو anal discomfort and rectal bleeding. The characteristic of the stool can vary greatly. Stool is normally light to dark brown. However, specific disease processes and indigestion of certain food and medication might change the appearance of stool. Diagnostic evaluation. Many modalities are available for diagnostic assessment of the GI tract. The majority of these tests and procedures are performed on an outpatient basis in a special setting designed for this purpose. For example, endoscopy suite or GI laboratory. Preparation for many of these studies include a clear liquid diet, fasting, the use of laxative or enema, and indigest or injection of a contrast agent or a radiopapic dye. These measures are poorly tolerated by some patients and are especially problematic in the elderly population. حقيقة ذني الميجرز تكون poorly علما للأولد age، قد يكون عندهم problem مشاكل بالهارت or بالرينال، فقد تكون poorly tolerated or patient with comorbidities because bowel preparation can significantly alter the internal fluid and electrolyte balance. راح تأثر على electrolyte balance for old age وخاصة اللي عندهم problem. General nursing intervention for the patient who is undergoing a GI diagnostic evaluation include establishing the nursing diagnosis, providing needed information about the test and the activities required of the patient, providing instruction about post-procedure care and activity restriction, helping the patient cope with discomfort and elevating anxiety, informing the primary care provider of known medical condition or abnormal laboratory values that might affect the procedure, assessing for adequate hydration before, during and immediately after the procedure, and providing education about maintenance of hydration. Serum laboratory studies in start or beginning diagnostic tests begin with serum laboratory studies including but not limited to CBC complete blood count, complete metabolic panels, triglyceride, liver function tests, and any procedure for laboratory studies. Stool test. Basic examination of the stool includes inspecting the specimen for consistency, color, and alkaline blood. Fecal alkaline blood testing (FOBT) is one of the most commonly performed stool tests. It can be useful in initiating screening for several disorders, although it is used most frequently in the early cancer detection program. تكون أو مستخدمة in the most frequently in early cancer detection program. Breath test. The hydrogen breath test used in the diagnosis of bacterial overgrowth in the intestine. This test determines the amount of hydrogen expelled in the breath after it has been procedure in the colon. Urea breath test detect the presence of H. pylori, the bacteria that can live in the mucosal lining of the stomach. انه هي تكون تعيش بالغشاء المخاطي المبطن للستومك and cause peptic ulcer disease. أي من الأمراض الشائعة بالجهاز الهضمي هي البيبتيك ألسر، القرح الهضمية اللي راح نتطرق لها إن شاء الله محاضرتنا اللي تجي. After the patient ingested a capsule of carbon label urea, a breath sample is obtained for 10 to 20 minutes later because H. pylori metabolized urea rapidly. The labeled carbon is absorbed quickly. It can then be measured as carbon dioxide in the expiration breathing to determine whether H. pylori is present. Abdominal ultrasonography أو ما يسمى بالسونار أو abdominal ultrasound. Ultrasonography is a non-invasive diagnostic technique based into internal. It is particularly useful in the detection of enlarged gallbladder or pancreas, the presence of gallstone, enlarged ovary, ectopic pregnancy or appendicitis. Advantage of abdominal ultrasonography include absence of ionizing radiation, no noticeable side effect, relatively low cost, and almost immediate result. نتائج حقيقة تكون مباشرة. It cannot be used to examine structure that lie behind bony tissue because bone prevents sound wave from travel into deeper structure. حقيقة يعطي صورة فقط الأعضاء التي لا تقع خلف العظام، لأن العظام راح السبب انه prevent sound wave تمنع الموجات الصوتية من from travel into deeper structure للتراكيب تكون أعمق اللي تكون خلف العظام. Gas and fluid in the abdomen or air in the lungs also prevent transmission of ultrasound. The ultrasound produce no ill effect. Nursing intervention. The patient is instructed for fast for 8 to 12 hours before the test to decrease the amount of gas in the bowel. Imaging studies. Numerous minimally invasive and non-invasive imaging studies including X-ray and contrast studies, computer tomography أي ما يسمى بالCT scan, 3-dimensional CT scan and magnetic resonance imaging MRI and positron emission tomography أي ما يطلق بالBT scan are available today. Computer tomography CT scan provide cross-sectional imaging of abdominal organ and structures. Multiple X-ray imaging or images are taken from numerous angles, digitals in a computer and then viewed on computer monitor. Nursing intervention. CT scan might be performed with or without oral or intravenous IV contrast. قد نستخدم الصبغة هاي أو قد ما نستخدمها. But the enhancement of the study is greater with use of a contrast agent. أي باستخدام راح يسوي لنا يعطينا أفضل صورة. Any allergies to a contrast agent such as iodine, the patient current serum creatinine level and urine human must be determined before administration of contrast agent. Magnetic resonance imaging (MRI). This non-invasive technique uses magnetic field and radio waves to produce imaging of the area. Being studies. The use of oral contrast agent to enhance the image has increased the application of this technique for the diagnosis of GI disease. It is useful in evaluating the abdominal soft tissue as well as neoplasms and other source of bleeding. Nursing intervention. A pre-study patient educated include no by oral or nothing by oral status for 6 to 9 or 8 hours before the study and removal of all jewelry and other metals. The patient and family are informed that the study might take 60 to 90 minutes. During this time, the technician will instruct the patient to take deep breathing and يأخذ نفس عميق at specific interval في فترات خاصة ومتقطعة. The close fitting scanners used in many MRI facilitating might induce feeling or claustrophobia, and the machine will make a notching sound during the procedure. Patient might choose to wear headset and listen to music or to wear blindfold during the procedure. حقيقة هذا البروسيجر انه يدخل مكان مغلق، فعندنا بعض المرضى يخافون من اماكن مغلقة، وبالتالي راح قد يكون يخلون blindfold during the procedure، بالاضافة الى صوت النوتشنج راح يصير اثناء الدخول بالجهاز، وبالتالي بعض المرضى قد نستخدم ان يرتدي headset and listen to music حتى ما يسمع هذا الصوت اللي يخليه انه يصير عنده فوبيا او خوف من هذا الصوت اللي يصدر. Endoscope procedure. Endoscope procedure used in GI tract assessment include fibroscopy or esophagus gastroduodenoscopy, EGD, colonoscopy, sigmoidoscopy, proctoscopy and endoscopy according to area or location. Upper gastrointestinal fibroscopy, esophagus gastroduodenoscopy, fibroscopy of the upper GI tract allow direct visualization of the esophageal, gastric and duodenal mucus through the lighting endoscope gastroscope. أي إنه يدخل من اسمه esophagus gastroduodenoscopy، أي يدخل ما يشمل بالesophagus والgastric بالإضافة إلى الduodenum. EGD, esophagus gastroduodenoscopy, is available when esophagus, gastro or duodenum disorder or inflammatory, neoplastic or infectious process are suspected. This procedure also can be used to evaluate esophagus and gastro motility and to collect secretion and tissue specimen for further analysis. In EGD, قلنا esophagus gastroduodenoscopy, this procedure views the GI tract through a viewing lens and can obtain image through the scope to document finding. Electronic video endoscope also available that attach direct to a video processor, converting the electronic signals into pictures on television screen. ERCP نوع الثاني EGD and ERCP endoscope retrograde cholangiopancreatography use the endoscope in combination with X-ray to view the ductal structure of the biliary tract. The side view flexible scope are used to visualize the common bile duct and the pancreatic and hepatic duct أو ducts through the ampulla of Vater in the duodenum. عن طريق الأنبولة of Vater يدخل إلى الديدنوم، أي ما يتوقف فقط للديدنوم إنه يدخل إلى البايل duct and pancreatic and hepatic duct. ARCB is helpful in evaluating jaundice, pancreatitis, pancreatic tumor, common bile duct, stone and biliary tract disease. This picture shows endoscope retrograde cholangiopancreatography ARCB. Upper GI fibroscopy also can be a therapeutic procedure when combined with other procedures. Therapeutic endoscope can be used to remove common bile duct stone, dilate structure and treat gastric bleeding and esophagus varices. Sclerotic solution can be أي سائل مصلب can be injected through the scope into attempt to control upper GIT bleeding حتى نسيطر على النزيف اللي يحدث بالGIT. After the patient is sedated, the endoscope is lubricated with a water soluble lubricate and passed smoothly and slowly along the back of the mouth and down into the esophagus. The procedure usually takes about 30 minutes. The patient might experience nausea, gagging or choking, use of topical anesthetic agent, and قد يمارس nausea and vomiting or gagging reflex, and moderate sedation. Make it is important to monitor and maintain the patient oral airway during the and after the procedure. Finger or air oximeter are used to monitor oxygen saturation. نستخدم البلس oximeter حتى نشوف الأكسجين saturation and supplemental oxygen might be administered if needed. Precaution must be taken to protect the scope because the fiber optic bundles can be broken if the scope is bent in acute angle. The patient wear a mouth guarding to keep from beating the scope. إن الجاردن هاي اللي يصير بالماوث حتى نمنع البيتنج أن يعض السكوب أثناء الانسيرشن. Manometry and electrophysiologic studies. Manometry and electrophysiologic studies are methods for evaluation patient or evaluating patient with GI mortality أي حركة الأمعاء disorder. The manometry test measures change in the intraluminal pressure. أي من اسم manometry يقيس لنا البريشر وين بالintraluminal pressure and the coordination of muscle activity in the GI tract with the pressure transmitted to computer analysis أو analyzer. Esophagus manometry is used to detect motility disorder of esophagus and the upper and lower esophagus sphincter, also known as esophageal motility studies. The patient must refrain from eating or drinking for 8 to 12 hours before the test. Medications that could have a direct effect on motility are withheld for 24 to 49 hours. A pressure sensitive catheter is inserted through the nose and is connected to transducer and video recorder. The patient then swallow small amount of water. Evaluation of patient for gastroesophageal reflux disease GERD typically include esophageal manometry and colonic manometry. Procedures are used to evaluate delayed gastric emptying and gastric and intestinal motility disorders such as irritable bowel syndrome. Anorectal manometry measures the resting tone of the internal anal sphincter and the contractibilities of external anal sphincter. It is helpful in evaluating patients with chronic constipation or fecal incontinence. A saline cleaning enema is administered 1 hour before the test. and position for the taste is either brown or the lateral position. Thank you for listening.